BPSC BPS 17, Medical Officer and Lady Medical Officer. Recall paper of the 29th of December 2025. 70 solved and verified questions from an authentic source. Put your headphones on for better focus. After each question you get 5 seconds, pause if you need to. Let us begin. Question 1. Most common cause of ureteric obstruction is Option A. Calculus. Option B. Tumor. Option C. Stricture. Option D. Blood clot. The correct answer is option A. Calculus. Let's go through the options. Tumor. Tumor is a less common cause. Stricture. Stricture is less common than stones. Blood clot. A blood clot is an uncommon cause. And the correct answer is calculus. Correct. A calculus stone is the commonest cause of ureteric obstruction. So, the right answer is option A. Calculus. Question 2. Initial treatment of chemical burns is Option A. Neutralizing agent. Option B. Excessive flushing with water. Option C. Topical antibiotics. Option D. Immediate debridement. The correct answer is option B. Excessive flushing with water. Let's go through the options. Neutralizing agent. A neutralizing agent generates heat and worsens the burn. Topical antibiotics. Topical antibiotics are not the initial step. Immediate debridement. Debridement comes later, not first. And the correct answer is excessive flushing with water. Correct. Immediate copious flushing with water dilutes and removes the chemical. So, the right answer is option B. Excessive flushing with water. Question 3. Which of the following is a site of portocaval anastomosis? Option A. Spleen. Option B. Anal canal. Option C. Gallbladder. Option D. Kidney. The correct answer is option B. Anal canal. Let's go through the options. Spleen. The spleen is not a portocaval anastomotic site. Gallbladder. The gallbladder is not a classic site. Kidney. The kidney is not a portocaval site. And the correct answer is anal canal. Correct. The anal canal, superior versus middle inferior rectal veins, is a site of portocaval anastomosis. So, the right answer is option B. Anal canal. Question 4. Dumping syndrome is seen after Option A. Cholecystectomy. Option B. Appendectomy. Option C. Gastrectomy. Option D. Colectomy. The correct answer is option C. Gastrectomy. Let's go through the options. Cholecystectomy. Cholecystectomy does not cause dumping. Appendectomy. Appendectomy does not cause dumping. Colectomy. Colectomy does not cause dumping. And the correct answer is gastrectomy. Correct. Dumping syndrome follows gastrectomy, rapid gastric emptying. So, the right answer is option C. Gastrectomy. Question 5. Which hernia is most frequently seen in males? Option A. Femoral. Option B. Umbilical. Option C. Incisional. Option D. Inguinal. The correct answer is option D. Inguinal. Let's go through the options. Femoral. Femoral hernia is commoner in females. Umbilical. Umbilical hernia is not the male predominant one here. Incisional. Incisional hernia relates to prior surgery. And the correct answer is inguinal. Correct, inguinal hernia is the commonest hernia in males. So, the right answer is option D. Inguinal. Question 6. Major complication of deep vein thrombosis is option A. Pulmonary embolism. Option B. Cellulitis. Option C. Varicose veins. Option D. Lymphedema. The correct answer is option A. Pulmonary embolism. Let's go through the options. Cellulitis. Cellulitis is a differential, not a DVT complication. Varicose veins. Varicose veins may follow but are not the major danger. Lymphedema. Lymphedema is a late, minor issue. And the correct answer is pulmonary embolism. Correct, pulmonary embolism is the major, life-threatening complication of DVT. So, the right answer is option A. Pulmonary embolism. Question 7. To maximize fertility, cryptorchidism should be treated before. Option A. 6 months. Option B. 1 year. Option C. 2 years. Option D. 5 years. The correct answer is option C. 2 years. Let's go through the options. 6 months. 6 months is earlier than the usual surgical window. 1 year. 1 year is acceptable but the classic teaching cutoff is 2 years. 5 years. 5 years is too late and risks infertility malignancy. And the correct answer is 2 years. Correct, orchidopexy before 2 years, ideally 1 to 2, preserves fertility. So, the right answer is option C. 2 years. Question 8. A 40-year-old with 4 children has postcoital bleeding for 2 months. Most important investigation is option A. Pap smear. Option B. Pelvic ultrasound. Option C. Biopsy of cervix. Option D. Complete blood count. The correct answer is option C. Biopsy of cervix. Let's go through the options. Pap smear. A pap smear screens but does not diagnose an invasive lesion. Pelvic ultrasound. Ultrasound does not assess the cervix for cancer. Complete blood count. A blood count does not diagnose the cause. And the correct answer is biopsy of cervix. Correct, postcoital bleeding needs a cervical biopsy to exclude carcinoma. So, the right answer is option C. Biopsy of cervix. Question 9. Most common cause of vesicovaginal fistula in Pakistan is option A. Obstetric injury. Option B. Pelvic surgery. Option C. Radiation. Option D. Malignancy. The correct answer is option A. Obstetric injury. Let's go through the options. Pelvic surgery. Pelvic surgery is a Western cause, less common here. Radiation. Radiation is an uncommon cause. Malignancy. Malignancy is an uncommon cause. And the correct answer is obstetric injury. Correct, in Pakistan, obstructed labor, obstetric injury, is the commonest cause of vesicovaginal fistula. So, the right answer is option A. Obstetric injury. Question 10. Emergency medicine to prevent pregnancy after rape is option A. Levonorgestrel. Option B. Combined oral pills daily. Option C. Medroxyprogesterone. Option D. Clomiphene. The correct answer is option A. Levonorgestrel. Let's go through the options. Combined oral pills daily. Daily combined pills are not the emergency regimen. Medroxyprogesterone. Medroxyprogesterone is a depot contraceptive, not emergency. Clomiphene. Clomiphene induces ovulation, the opposite of what is needed. And the correct answer is levonorgestrel. Correct. Levonorgestrel is the emergency contraceptive of choice after rape. So, the right answer is option A. Levonorgestrel. Question 11. In hirsutism, which finding questions the diagnosis of PCOS? Option A. Raised LH-FSH ratio. Option B. Elevated 17-hydroxyprogesterone. Option C. Polycystic ovaries on ultrasound. Option D. Insulin resistance. The correct answer is option B. Elevated 17-hydroxyprogesterone. Let's go through the options. Raised LH-FSH ratio. A raised LH-FSH ratio supports PCOS. Polycystic ovaries on ultrasound. Polycystic ovaries on ultrasound support PCOS. Insulin resistance. Insulin resistance supports PCOS. And the correct answer is elevated 17-hydroxyprogesterone. Correct. Elevated 17-hydroxyprogesterone points to congenital adrenal hyperplasia, questioning PCOS. So, the right answer is option B. Elevated 17-hydroxyprogesterone. Question 12. Toxin production is important in pathogenesis of all except. Option A. Clostridium tetani. Option B. Corynebacterium diphtheriae. Option C. Haemophilus influenzae. Option D. Vibrio cholerae. The correct answer is option C. Haemophilus influenzae. Let's go through the options. Clostridium tetani. Tetanus is toxin-mediated. Corynebacterium diphtheriae. Diphtheria is toxin-mediated. Vibrio cholerae. Cholera is toxin-mediated. And the correct answer is Haemophilus influenzae. Correct. H. Influenzae disease is largely capsule invasion-mediated, not toxin, so it is the exception. So, the right answer is option C. Haemophilus influenzae. Question 13. Which of the following is an acute consequence of infection? Option A. Fever. Option B. Amyloidosis. Option C. Fibrosis. Option D. Calcification. The correct answer is option A. Fever. Let's go through the options. Amyloidosis. Amyloidosis is a chronic sequela. Fibrosis. Fibrosis is a chronic sequela. Calcification. Calcification is a chronic late change. And the correct answer is fever. Correct. Fever is an acute consequence of infection. So, the right answer is option A. Fever. Question 14. Which is not used in immunization programs? Option A. Toxoids. Option B. Live attenuated vaccines. Option C. Killed vaccines. Option D. Human antibodies. The correct answer is option D. Human antibodies. Let's go through the options. Toxoids. Toxoids are used in immunization. Live attenuated vaccines. Live attenuated vaccines are used. Killed vaccines. Killed vaccines are used. And the correct answer is human antibodies. Correct. Human passive antibodies are immunoglobulin therapy, not part of active immunization programs. So, the right answer is option D. Human antibodies. Question 15. C-reactive protein may be raised in all except option A. Bacterial infection. Option B. Rheumatoid arthritis. Option C. Diabetes mellitus. Option D. Trauma. The correct answer is option C. Diabetes mellitus. Let's go through the options. Bacterial infection. Bacterial infection raises CRP. Rheumatoid arthritis. Rheumatoid arthritis raises CRP. Trauma. Trauma raises CRP. And the correct answer is diabetes mellitus. Correct. Uncomplicated diabetes mellitus does not typically raise CRP. So, the right answer is option C. Diabetes mellitus. Question 16. Correct definition of fever of unknown origin is option A. Fever over 38.3 degrees Celsius without diagnosis for 3 weeks. Option B. Fever over 37 degrees Celsius for 1 week. Option C. Fever over 40 degrees Celsius for 3 days. Option D. Any fever with negative cultures. The correct answer is option A. Fever over 38.3 degrees Celsius without diagnosis for 3 weeks. Let's go through the options. Fever over 37 degrees Celsius for 1 week. 1 week is too short and 37 degrees Celsius too low. Fever over 40 degrees Celsius for 3 days. 3 days is too short. Any fever with negative cultures. Negative cultures alone do not define fever. And the correct answer is fever over 38.3 degrees Celsius without diagnosis for 3 weeks. Correct. Fever is fever 38.3 degrees Celsius for greater than or equal to 3 weeks without a diagnosis after appropriate workup. So, the right answer is option A. Fever over 38.3 degrees Celsius without diagnosis for 3 weeks. Question 17. Staphylococcus aureus can cause all except option A. Scalded skin syndrome. Option B. Scarlet fever. Option C. Osteomyelitis. Option D. Food poisoning. The correct answer is option B. Scarlet fever. Let's go through the options. Scalded skin syndrome. Staph aureus causes scalded skin syndrome. Osteomyelitis. Staph aureus causes osteomyelitis. Food poisoning. Staph aureus causes toxin food poisoning. And the correct answer is scarlet fever. Correct. Scarlet fever is caused by Streptococcus pyogenes, not Staph aureus. So, the right answer is option B. Scarlet fever. Question 18. In a febrile returning traveler, the most important test is for option A. Dengue. Option B. Typhoid. Option C. Malaria. Option D. HIV. The correct answer is option C. Malaria. Let's go through the options. Dengue. Dengue is important but malaria must be excluded first. Typhoid. Typhoid is considered but not the priority test. HIV. HIV is not the immediate priority. And the correct answer is malaria. Correct. In a febrile returning traveler, malaria must be excluded urgently. It can be rapidly fatal. So, the right answer is option C. Malaria. Question 19. Which statement best describes intrinsic spinal cord lesions? Option A. Weakness is usually bilateral. Option B. Weakness is usually unilateral. Option C. Only sensory loss occurs. Option D. Cranial nerves are involved. The correct answer is option A. Weakness is usually bilateral. Let's go through the options. Weakness is usually unilateral. Unilateral weakness suggests an extrinsic compressive lesion. Only sensory loss occurs. Sensory-only loss is not the rule. Cranial nerves are involved. Cranial nerves are not involved in cord lesions. And the correct answer is weakness is usually bilateral. Correct. Intrinsic, central, cord lesions typically cause bilateral, often symmetrical weakness. So, the right answer is option A. Weakness is usually bilateral. Question 20. Bilateral spastic paraparesis is caused by deficiency of Option A. Vitamin B12. Option B. Iron. Option C. Vitamin C. Option D. Zinc. The correct answer is option A. Vitamin B12. Let's go through the options. Iron. Iron deficiency causes anemia, not myelopathy. Vitamin C. Vitamin C deficiency causes scurvy. Zinc. Zinc deficiency does not cause this. And the correct answer is vitamin B12. Correct. B12 deficiency causes subacute combined degeneration with bilateral spastic paraparesis. So, the right answer is option A. Vitamin B12. Question 21. Koplik spots are seen in Option A. Rubella. Option B. Measles. Option C. Mumps. Option D. Chickenpox. The correct answer is option B. Measles. Let's go through the options. Rubella. Rubella does not cause Koplik spots. Mumps. Mumps does not cause Koplik spots. Chickenpox. Chickenpox gives vesicles, not Koplik spots. And the correct answer is measles. Correct. Koplik spots, buccal mucosa, are pathognomonic of measles. So, the right answer is option B. Measles. Question 22. Which milk has the lowest concentration of protein? Option A. Cow milk. Option B. Buffalo milk. Option C. Goat milk. Option D. Human milk. The correct answer is option D. Human milk. Let's go through the options. Cow milk. Cow milk has higher protein than human milk. Buffalo milk. Buffalo milk is high in protein. Goat milk. Goat milk is high in protein. And the correct answer is human milk. Correct. Human milk has the lowest protein concentration, ideal for infants. So, the right answer is option D. Human milk. Question 23. A baby usually starts crawling at Option A. 4 months. Option B. 6 months. Option C. 9 months. Option D. 15 months. The correct answer is option C. 9 months. Let's go through the options. 4 months. 4 months is too early for crawling. 6 months. 6 months is sitting age. 15 months. 15 months is walking beyond. And the correct answer is 9 months. Correct, babies typically crawl around 9 months. So, the right answer is option C. 9 months. Question 24. Acute inflammatory cells are: option A, lymphocytes. Option B, neutrophils. Option C, plasma cells. Option D, macrophages. The correct answer is option B, neutrophils. Let's go through the options. Lymphocytes. Lymphocytes are chronic inflammatory cells. Plasma cells. Plasma cells are chronic. Macrophages. Macrophages are chronic subacute. And the correct answer is neutrophils. Correct, neutrophils are the hallmark acute inflammatory cells. So, the right answer is option B. Neutrophils. Question 25. Type of necrosis seen in tuberculosis is: option A, coagulative. Option B, liquefactive. Option C, caseous. Option D, fat necrosis. The correct answer is option C, caseous. Let's go through the options. Coagulative. Coagulative necrosis is typical of ischemic infarcts. Liquefactive. Liquefactive necrosis is seen in the brain abscess. Fat necrosis. Fat necrosis is seen in pancreatitis breast. And the correct answer is caseous. Correct, tuberculosis causes caseous necrosis. So, the right answer is option C. Caseous. Question 26. Apoptosis means: option A, programmed cell death. Option B, accidental cell death. Option C, cell swelling. Option D, tissue infarction. The correct answer is option A, programmed cell death. Let's go through the options. Accidental cell death. Accidental death is necrosis. Cell swelling. Cell swelling is necrosis, oncosis. Tissue infarction. Infarction is necrosis, not apoptosis. And the correct answer is programmed cell death. Correct, apoptosis is programmed, energy-dependent cell death. So, the right answer is option A. Programmed cell death. Question 27. The science studying mechanism of drugs and their effects is: option A, pharmacokinetics. Option B, pharmacodynamics. Option C, pharmacognosy. Option D, toxicology. The correct answer is option B, pharmacodynamics. Let's go through the options. Pharmacokinetics. Pharmacokinetics is what the body does to the drug, ADME. Pharmacognosy. Pharmacognosy studies drugs from natural sources. Toxicology. Toxicology studies poisons and adverse effects. And the correct answer is pharmacodynamics. Correct, pharmacodynamics studies the mechanism and effects of drugs on the body. So, the right answer is option B. Pharmacodynamics. Question 28. Which drug can cause bone marrow suppression? Option A, amoxicillin. Option B, chloramphenicol. Option C, azithromycin. Option D, ciprofloxacin. The correct answer is option B, chloramphenicol. Let's go through the options. Amoxicillin. Amoxicillin does not classically suppress marrow. Azithromycin? Azithromycin is not a marrow suppressant. Ciprofloxacin? Ciprofloxacin is not a marrow suppressant. And the correct answer is chloramphenicol. Correct, chloramphenicol causes bone marrow suppression and aplastic anemia. So, the right answer is option B. Chloramphenicol. Question 29. A patient with intermittent fever and splenomegaly most likely has option A. Tuberculosis. Option B. Malaria. Option C. Pneumonia. Option D. Urinary tract infection. The correct answer is option B. Malaria. Let's go through the options. Tuberculosis. TB gives chronic fever but splenomegaly with intermittent fever fits malaria better. Pneumonia. Pneumonia gives respiratory signs, not splenomegaly. Urinary tract infection. A UTI does not cause splenomegaly. And the correct answer is malaria. Correct, intermittent, paroxysmal fever with splenomegaly strongly suggests malaria. So, the right answer is option B. Malaria. Question 30. In evaluating bilateral leg edema, which is important? Option A. Cardiac assessment. Option B. Renal function. Option C. Liver function. Option D. All of the above. The correct answer is option D. All of the above. Let's go through the options. Cardiac assessment. Cardiac assessment matters, but not alone. Renal function. Renal function matters, but not alone. Liver function. Liver function matters, but not alone. And the correct answer is all of the above. Correct, bilateral leg edema needs cardiac, renal and hepatic assessment, all of the above. So, the right answer is option D. All of the above. Question 31. Albinism is option A. Localized hyperpigmentation. Option B. Generalized hypopigmentation. Option C. Post-inflammatory change. Option D. Localized hypopigmentation. The correct answer is option B. Generalized hypopigmentation. Let's go through the options. Localized hyperpigmentation. Albinism is not hyperpigmentation. Post-inflammatory change. It is not a post-inflammatory change. Localized hypopigmentation. It is generalized, not localized. And the correct answer is generalized hypopigmentation. Correct, albinism is a generalized congenital lack of melanin, hypopigmentation. So, the right answer is option B. Generalized hypopigmentation. Question 32. Which antihypertensive is contraindicated in bronchial asthma? Option A. Amlodipine. Option B. Losartan. Option C. Propranolol. Option D. Hydrochlorothiazide. The correct answer is option C. Propranolol. Let's go through the options. Amlodipine. Amlodipine is safe in asthma. Losartan. Losartan is safe in asthma. Hydrochlorothiazide. Hydrochlorothiazide is safe in asthma. And the correct answer is propranolol. Correct, propranolol, non-selective beta blocker, causes bronchospasm and is contraindicated in asthma. So, the right answer is option C. Propranolol. Question 33. A young female with sore throat joint pain and apical murmur has? Option A. Infective endocarditis. Option B. Rheumatic fever. Option C. Myocarditis. Option D. Pericarditis. The correct answer is option B. Rheumatic fever. Let's go through the options. Infective endocarditis. Infective endocarditis is possible, but the sore throat plus migratory arthritis picture fits rheumatic fever. Myocarditis. Myocarditis alone does not give this classic triad. Pericarditis. Pericarditis gives a rub, not this picture. And the correct answer is rheumatic fever. Correct post-streptococcal sore throat with polyarthritis and a murmur is rheumatic fever. So, the right answer is option B. Rheumatic fever. Question 34. In TENI, which electrolyte is decreased? Option A. Sodium. Option B. Potassium. Option C. Chloride. Option D. Calcium. The correct answer is option D. Calcium. Let's go through the options. Sodium. Sodium changes do not cause TENI. Potassium. Potassium is not the TENI electrolyte. Chloride. Chloride is not the cause. And the correct answer is calcium. Correct hypocalcemia, low calcium, causes TENI. So, the right answer is option D. Calcium. Question 35. A patient with mask-like face and resting tremor has. Option A. Alzheimer's disease. Option B. Parkinson's disease. Option C. Huntington disease. Option D. Wilson disease. The correct answer is option B. Parkinson's disease. Let's go through the options. Alzheimer's disease. Alzheimer causes dementia, not the Parkinsonian face. Huntington disease. Huntington causes chorea. Wilson disease. Wilson disease is possible in the young, but the classic pairing is Parkinson. And the correct answer is Parkinson's disease. Correct, a mask-like face with resting tremor is Parkinson's disease. So, the right answer is option B. Parkinson's disease. Question 36. Antidote for heparin overdose is. Option A. Vitamin K. Option B. Protamine sulfate. Option C. Fresh frozen plasma. Option D. Aminocaproic acid. The correct answer is option B. Protamine sulfate. Let's go through the options. Vitamin K. Vitamin K reverses warfarin, not heparin. Fresh frozen plasma. FFP is not the specific heparin antidote. Aminocaproic acid. Aminocaproic acid is an antifibrinolytic, not for heparin. And the correct answer is protamine sulfate. Correct, protamine sulfate is the antidote for heparin. So, the right answer is option B. Protamine sulfate. Question 37. A 45-year-old woman with cold intolerance and weight gain should undergo. Option A. Blood glucose. Option B. Thyroid function tests. Option C. Serum cortisol. Option D. Complete blood count. The correct answer is option B. Thyroid function tests. Let's go through the options. Blood glucose. Blood glucose does not explain cold intolerance and weight gain. Serum cortisol. Cortisol is for adrenal disease. Complete blood count. A blood count is non-specific. And the correct answer is thyroid function tests. Correct. Cold intolerance with weight gain suggests hypothyroidism. Check thyroid function. So, the right answer is option B. Thyroid function tests. Question 38. Normal heart rate of a neonate is option A 60 to 100 per minute. Option B 100 to 120 per minute. Option C 120 to 160 per minute. Option D 160 to 200 per minute. The correct answer is option C 120 to 160 per minute. Let's go through the options. 60 to 100 per minute. 60 to 100 is an adult rate. 100 to 120 per minute. 100 to 120 is too low for a neonate. 160 to 200 per minute. 160 to 200 is tachycardia. And the correct answer is 120 to 160 per minute. Correct. Normal neonatal heart rate is about 120 to 160 per minute. So, the right answer is option C. 120 to 160 per minute. Question 39. Neonatal period extends up to option A 1 week. Option B 2 weeks. Option C 4 weeks. Option D 6 weeks. The correct answer is option C 4 weeks. Let's go through the options. 1 week. 1 week is too short. 2 weeks. 2 weeks is too short. 6 weeks. 6 weeks is beyond the neonatal period. And the correct answer is 4 weeks. Correct. The neonatal period extends up to 4 weeks, 28 days. So, the right answer is option C. 4 weeks. Question 40. Which anticoagulant is safe in pregnancy? Option A warfarin. Option B heparin. Option C rivaroxaban. Option D high-dose aspirin. The correct answer is option B heparin. Let's go through the options. Warfarin. Warfarin is teratogenic and unsafe in pregnancy. Rivaroxaban. Rivaroxaban is not recommended in pregnancy. High-dose aspirin. High-dose aspirin is not the safe anticoagulant. And the correct answer is heparin. Correct. Heparin, LMWH, does not cross the placenta and is safe in pregnancy. So, the right answer is option B. Heparin. Question 41. Which does not cause chronic cough with a normal chest X-ray? Option A asthma. Option B gastroesophageal reflux. Option C postnasal drip. Option D pulmonary fibrosis. The correct answer is option D pulmonary fibrosis. Let's go through the options. Asthma. Asthma causes chronic cough with a normal film. Gastroesophageal reflux. GERD causes chronic cough with a normal film. Postnasal drip. Postnasal drip causes chronic cough with a normal film. And the correct answer is pulmonary fibrosis. Correct. Pulmonary fibrosis shows an abnormal X-ray, so it does not fit a normal film. So, the right answer is option D. Pulmonary fibrosis. Question 42. Which does not typically cause wheeze? Option A asthma. Option B COPD. Option C tracheal tumor. Option D heart failure. The correct answer is option C, tracheal tumor. Let's go through the options. Asthma. Asthma causes wheeze. COPD. Cough causes wheeze. Heart failure. Heart failure causes cardiac wheeze. And the correct answer is tracheal tumor. Correct, a tracheal tumor causes stridor, fixed obstruction, not typical wheeze. So, the right answer is option C. Tracheal tumor. Question 43. Which is not a feature of tension pneumothorax? Option A, tracheal deviation. Option B, hypotension. Option C, bradycardia. Option D, absent breath sounds. The correct answer is option C, bradycardia. Let's go through the options. Tracheal deviation. Tracheal deviation is a feature of tension pneumothorax. Hypotension. Hypotension is a feature. Absent breath sounds. Absent breath sounds is a feature. And the correct answer is bradycardia. Correct, tension pneumothorax causes tachycardia, not bradycardia, so bradycardia is the exception. So, the right answer is option C. Bradycardia. Question 44. Weight loss and malabsorption are commonly seen in Option A, small bowel bacterial overgrowth. Option B, gastritis. Option C, peptic ulcer. Option D, hemorrhoids. The correct answer is option A, small bowel bacterial overgrowth. Let's go through the options. Gastritis. Gastritis does not cause malabsorption. Peptic ulcer. Peptic ulcer does not cause malabsorption. Hemorrhoids. Hemorrhoids cause bleeding, not malabsorption. And the correct answer is small bowel bacterial overgrowth. Correct, small bowel bacterial overgrowth causes malabsorption and weight loss. So, the right answer is option A. Small bowel bacterial overgrowth. Question 45. Lactose intolerance causes diarrhea after consuming. Option A, bread. Option B, milk. Option C, rice. Option D, meat. The correct answer is option B, milk. Let's go through the options. Bread. Bread, wheat, is a gluten issue, not lactose. Rice. Rice does not contain lactose. Meat. Meat does not contain lactose. And the correct answer is milk. Correct, lactose intolerance causes diarrhea after milk, lactose. So, the right answer is option B. Milk. Question 46. Clostridium difficile diarrhea is treated with Option A, intravenous ceftriaxone. Option B, oral vancomycin. Option C, oral amoxicillin. Option D, intravenous gentamicin. The correct answer is option B, oral vancomycin. Let's go through the options. Intravenous ceftriaxone. 4-ceftriaxone does not treat C. difficile. Oral amoxicillin. Oral amoxicillin can worsen it. Intravenous gentamicin. 4-gentamicin does not treat it. And the correct answer is oral vancomycin. Correct, oral vancomycin or fidaxomicin treats C. difficile colitis. So, the right answer is option B. Oral vancomycin. Question 47. Mechanical dysphagia is suggested by Option A, food bolus impaction. Option B, dysphagia to liquids only. Option C, associated facial weakness. Option D. Slow eating since childhood. The correct answer is option A. Food bolus impaction. Let's go through the options. Dysphagia to liquids only. Dysphagia to liquids suggests a motility, neurological cause. Associated facial weakness. Facial weakness suggests a neuromuscular cause. Slow eating since childhood. Lifelong slow eating suggests a functional cause. And the correct answer is food bolus impaction. Correct. Food bolus impaction indicates a mechanical, structural cause of dysphagia. So, the right answer is option A. Food bolus impaction. Question 48. Polyuria may be caused by option A. Lithium toxicity. Option B. Beta blockers. Option C. Statins. Option D. Iron supplements. The correct answer is option A. Lithium toxicity. Let's go through the options. Beta blockers. Beta blockers do not cause polyuria. Statins. Statins do not cause polyuria. Iron supplements. Iron does not cause polyuria. And the correct answer is lithium toxicity. Correct. Lithium causes nephrogenic diabetes insipidus and polyuria. So, the right answer is option A. Lithium toxicity. Question 49. In an oliguric patient, which sign suggests fluid depletion? Option A. Postural hypotension. Option B. Raised jugular venous pressure. Option C. Peripheral edema. Option D. Hypertension. The correct answer is option A. Postural hypotension. Let's go through the options. Raised jugular venous pressure. A raised JVP suggests fluid overload, not depletion. Peripheral edema. Peripheral edema suggests overload. Hypertension. Hypertension does not indicate depletion. And the correct answer is postural hypotension. Correct. Postural, orthostatic, hypotension indicates volume depletion in an oliguric patient. So, the right answer is option A. Postural hypotension. Question 50. Which feature is consistent with urinary tract infection? Option A. Urea with nitrites. Option B. Proteinuria alone. Option C. Glycosuria. Option D. Ketonuria. The correct answer is option A. Urea with nitrites. Let's go through the options. Proteinuria alone. Proteinuria alone suggests renal disease. Glycosuria. Glycosuria suggests diabetes. Ketonuria. Ketonuria suggests fasting DACA. And the correct answer is urea with nitrites. Correct. Urea with nitrites strongly supports a urinary tract infection. So, the right answer is option A. Urea with nitrites. Question 51. Which anti-TB drug causes peripheral neuritis? Option A. Rifampicin. Option B. Isoniazid. Option C. Pyrazinamide. Option D. Streptomycin. The correct answer is option B. Isoniazid. Let's go through the options. Rifampicin. Rifampicin causes orange secretions hepatitis, not classic neuritis. Pyrazinamide. Pyrazinamide causes hyperuricemia. Streptomycin. Streptomycin is ototoxic. And the correct answer is isoniazid. Correct. Isoniazid causes peripheral neuritis, prevented by pyridoxine B6. So, the right answer is option B. Isoniazid. Question 52. Which organism exists in many strains? Option A. Virus. Option B. Fungus. Option C. Protozoa. Option D. Helminth. The correct answer is option A. Virus. Let's go through the options. Fungus. Fungi are not noted for many strains here. Protozoa. Protozoa are not the best answer. Helminth. Helminths are not the best answer. And the correct answer is virus. Correct. Viruses exist in many strains serotypes, high antigenic variation. So, the right answer is option A. Virus. Question 53. Flu vaccine becomes effective after. Option A. 2 days. Option B. 7 days. Option C. 15 days. Option D. 30 days. The correct answer is option C. 15 days. Let's go through the options. 2 days. 2 days is too soon for immunity. 7 days. 7 days is too soon. 30 days. 30 days is later than needed. And the correct answer is 15 days. Correct. The flu vaccine becomes effective after about 2 weeks, 15 days. So, the right answer is option C. 15 days. Question 54. Best recommendation for a textile worker with asthma is. Option A. Bronchodilators only. Option B. Change of occupation. Option C. Use of face mask. Option D. Long-term steroids. The correct answer is option B. Change of occupation. Let's go through the options. Bronchodilators only. Bronchodilators alone do not remove the trigger. Use of face mask. A mask reduces but does not eliminate exposure. Long-term steroids. Long-term steroids treat symptoms, not the cause. And the correct answer is change of occupation. Correct. For occupational, textile, asthma, removing exposure, change of occupation is the definitive advice. So, the right answer is option B. Change of occupation. Question 55. Single most important clue of BCG vaccination is. Option A. BCG scar on upper deltoid. Option B. Tuberculin skin test. Option C. Vaccination card. Option D. Chest X-ray. The correct answer is option A. BCG scar on upper deltoid. Let's go through the options. Tuberculin skin test. A tuberculin test is not specific for prior BCG. Vaccination card. A card can be lost unreliable. Chest X-ray. A chest X-ray does not confirm BCG. And the correct answer is BCG scar on upper deltoid. Correct. A BCG scar over the deltoid is the single best clue to prior BCG vaccination. So, the right answer is option A. BCG scar on upper deltoid. Question 56. Best investigation for suspected sinusitis is. Option A. Plain X-ray. Option B. CT scan. Option C. MRI. Option D. Ultrasound. The correct answer is option B. CT scan. Let's go through the options. Plain X-ray. Plain X-ray misses many sinus lesions. MRI. MRI is for soft tissue intracranial extension, not first line. Ultrasound. Ultrasound is limited for sinuses. And the correct answer is CT scan. Correct, CT is the best imaging for sinusitis and its complications. So, the right answer is option B. CT scan. Question 57. Most common complication of otitis media is option A. Mastoiditis. Option B. Meningitis. Option C. Brain abscess. Option D. Facial palsy. The correct answer is option A. Mastoiditis. Let's go through the options. Meningitis. Meningitis is a serious but less common complication. Brain abscess. Brain abscess is less common. Facial palsy. Facial palsy is less common. And the correct answer is mastoiditis. Correct, mastoiditis is the commonest complication of otitis media. So, the right answer is option A. Mastoiditis. Question 58. Throat infection spreads to the middle ear through option A. External auditory canal. Option B. Eustachian tube. Option C. Blood stream. Option D. Lymphatics. The correct answer is option B. Eustachian tube. Let's go through the options. External auditory canal. The external canal does not connect throat to middle ear. Blood stream. Blood spread is not the usual route. Lymphatics. Lymphatic spread is not the usual route. And the correct answer is Eustachian tube. Correct, infection spreads from throat to middle ear via the Eustachian tube. So, the right answer is option B. Eustachian tube. Question 59. Deficiency of fiber in diet leads to option A. Diarrhea. Option B. Vomiting. Option C. Peptic ulcer. Option D. Constipation. The correct answer is option D. Constipation. Let's go through the options. Diarrhea. Fiber deficiency does not cause diarrhea. Vomiting. It does not cause vomiting. Peptic ulcer. It does not cause peptic ulcer. And the correct answer is constipation. Correct, low dietary fiber leads to constipation. So, the right answer is option D. Constipation. Question 60. Most common facial bone fracture is option A. Mandible. Option B. Maxilla. Option C. Nasal bone. Option D. Zygoma. The correct answer is option C. Nasal bone. Let's go through the options. Mandible. The mandible is a common fracture but not the single commonest facial bone. Maxilla. Maxillary fractures are less common than nasal. Zygoma. Zygoma fractures are less common than nasal. And the correct answer is nasal bone. Correct, the nasal bone is the commonest facial bone fracture. So, the right answer is option C. Nasal bone. Question 61. Drug of choice for typhoid in pregnancy is option A. Ciprofloxacin. Option B. Cefixime. Option C. Chloramphenicol. Option D. Doxycycline. The correct answer is option B. Cefixime. Let's go through the options. Ciprofloxacin. Ciprofloxacin is avoided in pregnancy. Chloramphenicol. Chloramphenicol risks grey baby syndrome near term. Doxycycline. Doxycycline is contraindicated in pregnancy. And the correct answer is cefixime. Correct, cefixime is a safe drug of choice for typhoid in pregnancy. So, the right answer is option B. Cefixime. Question 62. Most common site of ectopic pregnancy is option A. Isthmus, option B. Ampulla, option C. Ovary, option D. Cervix. The correct answer is option B. Ampulla. Let's go through the options. Isthmus. The isthmus is a less common ectopic site. Ovary. The ovary is a rare site. Cervix. The cervix is a rare site. And the correct answer is ampulla. Correct, the ampulla of the fallopian tube is the commonest ectopic site. So, the right answer is option B. Ampulla. Question 63. Test used for detection of hearing losses. Option A. Audiometer. Option B. Ophthalmoscope. Option C. Spirometer. Option D. Tonometer. The correct answer is option A. Audiometer. Let's go through the options. Ophthalmoscope. An ophthalmoscope examines the eye. Spirometer. A spirometer tests lung function. Tonometer. A tonometer measures eye pressure. And the correct answer is audiometer. Correct, an audiometer detects and quantifies hearing loss. So, the right answer is option A. Audiometer. Question 64. Most common cause of retinal hemorrhage in adults is option A. Hypertension. Option B. Diabetes. Option C. Trauma. Option D. Anemia. The correct answer is option B. Diabetes. Let's go through the options. Hypertension. Hypertension causes retinal hemorrhage, but diabetes is the commonest. Trauma. Trauma is a less common cause. Anemia. Anemia is a less common cause. And the correct answer is diabetes. Correct, diabetes, diabetic retinopathy, is the commonest cause of retinal hemorrhage in adults. So, the right answer is option B. Diabetes. Question 65. Sudden loss of vision with red eye indicates option A. Cataract. Option B. Acute angle closure glaucoma. Option C. Central retinal artery occlusion. Option D. Refractive error. The correct answer is option B. Acute angle closure glaucoma. Let's go through the options. Cataract. Cataract causes gradual, painless vision loss. Central retinal artery occlusion. Crow gives sudden painless loss without a red eye. Refractive error. Refractive error does not cause sudden red eye vision loss. And the correct answer is acute angle closure glaucoma. Correct, sudden vision loss with a red, painful eye suggests acute angle closure glaucoma. So, the right answer is option B. Acute angle closure glaucoma. Question 66. Which eye sign is seen in Horner syndrome? Option A. Mydriasis. Option B. Exophthalmos. Option C. Lid retraction. Option D. Meiosis. The correct answer is option D. Meiosis. Let's go through the options. Mydriasis. Mydriasis is the opposite of Horner. Exophthalmos. Exophthalmos is not a Horner sign. Lid retraction. Horner gives ptosis, not lid retraction. And the correct answer is meiosis. Correct, Horner syndrome causes meiosis with ptosis and anhidrosis. So, the right answer is option D. Meiosis. Question 67. Pituitary adenoma causes. Option A. Bitemporal hemianopia. Option B. Homonymous hemianopia. Option C. Central scotoma. Option D. Total blindness. The correct answer is option A. Bitemporal hemianopia. Let's go through the options. Homonymous hemianopia. Homonymous hemianopia is a tract cortical lesion. Central scotoma. Central scotoma is optic nerve disease. Total blindness. Total blindness is not the typical early defect. And the correct answer is bitemporal hemianopia. Correct, a pituitary adenoma compresses the optic chiasm, causing bitemporal hemianopia. So, the right answer is option A. Bitemporal hemianopia. Question 68. LASIK is used for correction of. Option A. Myopia. Option B. Cataract. Option C. Glaucoma. Option D. Retinal detachment. The correct answer is option A. Myopia. Let's go through the options. Cataract. Cataract needs lens surgery, not LASIK. Glaucoma. Glaucoma is not treated by LASIK. Retinal detachment. Retinal detachment needs retinal surgery. And the correct answer is myopia. Correct, LASIK corrects refractive errors such as myopia. So, the right answer is option A. Myopia. Question 69. Eye color is determined by. Option A. Cornea. Option B. Lens. Option C. Iris. Option D. Retina. The correct answer is option C. Iris. Let's go through the options. Cornea. The cornea is clear and does not determine eye color. Lens. The lens does not determine eye color. Retina. The retina does not determine eye color. And the correct answer is iris. Correct, the iris, its melanin, determines eye color. So, the right answer is option C. Iris. Question 70. Breath holding spells usually stop at what age? Option A. 1 year. Option B. 3 years. Option C. 6 years. Option D. 10 years. The correct answer is option C. 6 years. Let's go through the options. 1 year. 1 year is too early for resolution. 3 years. 3 years is earlier than the usual cutoff. 10 years. 10 years is later than typical. And the correct answer is 6 years. Correct, breath holding spells usually stop by about 6 years of age. So, the right answer is option C. 6 years.